Welcome to the second part of the sepsis training video. The purpose of this training video is to ensure all relevant healthcare workers can complete the sepsis screening tool which is available in Meditech. Please ensure that you have watched the first video, which contains a presentation written by Dr. Arifin. When you suspect a patient has sepsis, the Sepsis Six screening tool will need to be completed. A task will have been raised on your rounds list prompting the completion of the document. The task is generated by nursing staff when a patient scores a 3 in 1 parameter or 5 and higher overall on the News 2 Observations Assessment. Access your patient's record and then click on the Document tab. Select New and from the standard list find the Sepsis Screening tool. This can be added to your favourite list of documents to save time in the future. Completing the Sepsis Screening tool will help you to diagnose sepsis and direct you to the Sepsis Six Pathway. The screening tool starts by stating the criteria of patient that the tool applies to. If the patient is at the end of their life and the correct pathway is in place, then there is no need to continue to fill out the rest of the form. In this instance, click on the Yes and a pop-up appears to that effect. Otherwise, leave the field as it is and continue to fill out the form. In the next section, you will be able to see the patient's current News 2 score as it will pull through the document. If the patient has a score of 5 or more, it will be mandatory to continue the document regardless of whether the patient looks sick. If the score is less than 5 and the patient does look sick, continue to fill out the document. If the patient has a score of 3 in 1 parameter, which must be determined from viewing the observations, you must complete the document regardless of whether the patient looks sick. If the patient does not look sick, a pop-up will appear stating that there is a low risk of sepsis and to use other protocols to treat the patient. Stage 2 of the screening tool asks if the patient's condition could be due to infection. Select the appropriate responses. In the third section, select any red flags which apply to the patient's condition. Selecting any of these flags will trigger a pop-up to initiate the Sepsis Six Pathway. Click on the Add section at the bottom of the screen and add the appropriate pathway. Be aware that 3 pathways are available, so please be careful when making your selection. Now complete the pathway. In the time 0 field, enter the time the interventions listed below were initiated. The rest of the pathway is self-explanatory and just requires completion. 2 things to remember. Take bloods, including lactate and blood cultures, together. Click on the protocol button at the bottom of the screen to locate the links for the antimicrobial policies as stated in the document. After delivering the Sepsis 6, review the patient and follow the instructions and advice given at the end of the pathway. This concludes the training on how to complete the Sepsis 6 screening tool in Meditech.